For those suffering with failing kidneys, dialysis is a way of life. 3 times a week, they have to have their blood purified, and that can be a burden, of course, but it keeps them alive. A new study, however, is suggesting they should actually undergo the procedure more often. Our medical expert, Dr. Karl Kabasele, joins me now to explain. Karl, what's the study say?
Well, as you mentioned, the standard of care for dialysis is generally 3 times a week. What this study wanted to do is look at the gap. So if you imagine 3 times a week, let's say Monday, Wednesday, Friday, you're going to have 2 days at some point where you're not getting dialysis. And they call that sort of the long gap between treatments. And what this study wanted to do was look at the risk during that long gap of certain complications or health problems associated with not getting dialysis. And they did find that there was a significant increase or higher number of people dying right after that long gap, of people having heart attacks and strokes. So there was, and mind you, this was a retrospective study, so yes, they looked at data sort of backwards as opposed to doing a trial where they go forwards. But it appears from this data that there may be an issue with that gap.
All right, so what are they recommending?
Well, they're saying that this is a proof of a concept in a sense. What they're saying is that there needs to be more research, so a prospective study where we look at people who get it, let's say, 3 times a week and those who get it every day, and see if there truly is a causal link there. They're also saying, though, that, you know, not only does this need to be looked into further, but people who are on dialysis need to have a conversation with their doctors, with their dialysis teams, to make sure that they're getting adequate treatment.
I wonder what the implications are of more frequent dialysis for people. Are there side effects that people need to be concerned about?
Well, yeah, I mean, any treatment has side effects, and you could just start with the logistics, if you will, or the burden of the treatment. So people, dialysis will take usually at least 3 or 4 hours. You have to sort of sit in a chair, you're plugged into a machine, and the machine, the dialysis machine, is an artificial kidney, basically. It's filtering your blood, it's balancing the fluids, it's taking out toxins, and also making sure that your electrolytes are in the right proportions.
Is there anything that people can do to boost their chances, as it were, given this information?
Boost their chances of not having the problem? Or?
Yeah, well, I guess what I'm saying is, you know, if they don't have more frequent trips, if that's not been determined for them, is there something they can do in those 2-day gaps that'll give them a better chance?
Well, so in general, people who are on dialysis are told to take certain medications if necessary, are told to watch their diets, to generally live a healthier life. So that's sort of the personal responsibility. But then on the systemic level, what we need to do is figure out, do people need to be dialyzed more often? And what should the standard of care be? But having said that, everyone who's on dialysis should have periodic sort of check-ins with their specialist to make sure that what they're doing is adequate for their case.
And for the rest of us, how do we prevent from having to go on dialysis in the first place?
Well, some of the biggest risk factors for kidney disease are high blood pressure and diabetes. So the simple thing to do is make sure your blood pressure is in a normal range, and your doctor should be doing that on a regular basis, checking your blood pressure.
You can do it at the Shoppers or the drugstore too, if you want, right? They're everywhere. They're at the gym.
Yeah, that's right. Yeah. I mean, it's no substitute for the high quality equipment that your doctor's office has. So that's number one. If you have diabetes, make sure your blood sugar is under very tight control, because that's the way you decrease your chances of complications. And in terms of early detection of kidney disease, a simple blood test that looks at something called creatinine in the blood is a marker for your kidney function. So, you know, at your annual checkup, your doctor can do a simple blood test to make sure your kidneys are working properly.
All right. Well, thank you very much. CBC medical expert Dr. Karl Kabasele joining me live in studio. Thank you.
Thank you.
Okay. Just a warning.